Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. Vaping, the new national healthcare epidemic. Thousands have been hospitalized, several dozen have died. What is going on here? Find out right now. My guests tonight are Dr. Clifford Mitchell and Dr. Travis Gayles. Dr. Mitchell is director of the Maryland Environmental Health Bureau, and Dr. Gayles is the Montgomery County Healthcare Officer. Gentlemen, welcome to Housecall.
Nice to be here.
Thank you.
We'll start off with you, Dr. Mitchell. Briefly tell our viewers about your professional background.
Sure. Currently, I'm, as you said, the director of the Environmental Health Bureau at the Maryland Department of Health, the state health agency. I've been there since 2006, and before that, I was on the faculty at Johns Hopkins School of Public Health for 14 years, where I did research, saw patients, and taught occupational medicine residents.
How interesting. Dr. Gayles, what's your background?
Sure. Thank you for the opportunity to be here. I am a clinically trained pediatrician specializing in adolescent medicine and currently serve as the health officer and chief of public health services for Montgomery County.
Very nice. So we'll start off with you, Mitchell, Dr. Mitchell. Briefly, share with our viewers what exactly is vaping.
Well, vaping, there are several different kinds of products out on the market, and people collectively think of them as vaping, but they range from electronic cigarettes, which were some of the oldest devices, to newer devices which are called vaping devices. Basically, they have a similar kind of design. They have a heating element, which is usually a wire filament of some kind, and that wire filament will heat either a liquid into an aerosol that can be inhaled, or in some cases, it'll heat a waxy substance in a process called dabbing, which you may also have heard of. And dabbing is simply taking the product and applying it directly on the coil, and then it will heat or superheat, and you'll inhale that. So there are a whole series of these things. They come in many different shapes and sizes, and people have been using them as an alternative in some cases for nicotine products, and in other cases for use of different kinds of cannabis-derived products.
Marijuana.
Yep.
Okay. This will be a technical question. How does the vaping mechanism differ from e-cigarettes?
Well, so a lot of the design of these things has to do with what temperature you heat the product to, and in some cases it has to do with the form of the aerosol. But basically they're somewhat similar in the sense that you are taking a liquid product or a waxy substance, and then you are heating it. Now, what happens is, because these have variable degrees of heat, which you in some of the devices can adjust, the degree of what you are inhaling and what exactly the chemical composition is may vary even in a single product. And some of the challenge, I think, from a public health point of view about these products is we don't know what the formulations are in many cases because they are proprietary. And in other cases, we don't necessarily know what form they're being inhaled in, because if you adjust the temperature, you can actually adjust the thermal products that are derived from that liquid. So it covers a lot of different materials.
Dr. Gayles, given that there's all these different mechanisms, old-fashioned smoking cigarettes, and now e-cigarettes, and now vaping, is there any data to suggest that these different mechanisms may be more toxic than others? For example, is the higher temperature, I presume, vaping, are you potentially burning literally your airways as opposed to a cigarette?
Sure, certainly there's a risk for that type of phenomena to happen. One of the challenges, in thinking about mechanism of delivery is thinking of it from the perspective of, particularly with young people. We know that smoking cigarettes has gone down, the rate of doing that. but the rate of vaping and juuling has increased. And so we are increasingly concerned because the concentration of nicotine also is significantly higher within the vaping and the e-cigarettes in comparison to the traditional old cigarette model. And for young people in particular, given that that is a more popular activity, they're getting exposed to nicotine earlier, as we see more evidence that middle school kids are vaping and using e-cigarettes much at higher rates than they were smoking cigarettes back in the day. So we're concerned about the early initiation to nicotine, the increased exposure due to the higher concentration of nicotine in the vaping products. And we know all of those things lead to increased addiction, increased withdrawal to nicotine when being pulled off, as well as it suggests early initiation into other substances that may be more toxic and concerning than the nicotine itself.
All your comments raise fascinating questions. I'll follow up on that. Do you think that e-cigarettes or vaping is a gateway to going on to cigarette smoking?
Well, I think it's a potential gateway to not only cigarette smoking, but as Dr. Mitchell referenced, that it's concerning for also introduction to other substances. So when you're vaping and juuling, you have the opportunity to use a liquid that's not nicotine based, and that has been part of the concern here within the county, is that we have seen evidence that suggests that kids are vaping and juuling liquids that are cannabinoid based or potentially laced with other substances outside of nicotine.
So drugs.
Yeah, so drugs, yes.
Right.
So the short and long answer is yes, we are concerned that there would be increased affinity to traditional tobacco-based products, but also significant concern due to exposure to other substances as well.
And I think one other thing to note about that is that if you look at the nicotine content in some of the products that are available commercially, they are very, very high. In some cases, a single Juul-like device, whether it's Juul or something else, can have the nicotine content of an entire pack of cigarettes. So that when you're juuling, you are in some cases getting a much more concentrated exposure to nicotine.
And therefore a greater risk of addiction.
Absolutely.
And yet, Dr. Mitchell, when e-cigarettes, the first generation came out, it was presented to the public as being safer than cigarettes. How do you respond?
Well, there's been a lot of discussion about that. And I think that what we recognize is that for people who are already smokers, there is no question but that smoking cigarettes is bad. We've got tons of data historically, going back many, many generations, to say that we do not want people to be smoking cigarettes. So for people, in fact, who are smoking cigarettes, an alternative to that, which could be an electronic cigarette, although there are other proven means to get off of cigarettes or tobacco, I would say from a public health point of view, we certainly want to discourage people from consuming tobacco products. The concern, however, here, as Dr. Gayles has pointed out, is that the marketing of flavored nicotine products in general in the United States has obviously been and is very concerning because it really does appear to be targeting young people who are never smokers at the point that they start to use these products. So from a public health point of view, the question about harm reduction for people who are already smokers, I would like to get them off of tobacco, and if an electronic cigarette is able to do that, I would not discourage somebody who is already a smoker from finding an alternative, although I would point out there are other alternatives that don't involve consumption of nicotine that have been shown medically to be acceptable.
Dr. Gayles, you had mentioned earlier younger and younger people accessing e-cigarettes and vaping. Is it legal for a young child, let's say somebody who's 12, to purchase a e-cigarette or a vaping device?
Absolutely not. Much like cigarettes, vaping devices are restricted to, currently in the state of Maryland as of October 1st, are restricted to those who are over 21 and older, with minor exceptions. And so even historically, when the tobacco age was 18, vaping products was 18 as well. So 12-year-olds have never been, it's never been legal for them to purchase tobacco products, whether they're traditional cigarettes or vaping devices.
So has the Montgomery County government done any research then and to determine how 12-year-olds are acquiring vaping devices?
Sure. There's been extensive work done on behalf of Health and Human Services as well as our law enforcement partners, more so with the law enforcement team who has historically looked at purchasing patterns. They go out and they have adolescent buyers go into vape stores to see if they're sold those products, and if they are, they issue the citations per the legal parameters. And so that process has helped inform the public health outreach that we have done. And as a result of that information, we have stepped up what we do from a public health perspective in terms of outreach and education. We, in the spring of this year, released a public health alert to make sure that parents were aware of what was happening in schools, because we did have a couple of episodes where kids were reported to be vaping and then required a higher level of care due to passing out and losing consciousness.
Terrible.
And so as a result of that, we did a public health alert. We are working with Montgomery County Public Schools to create an anti-vaping campaign on 2 levels. One that is education-based in the schools, and then another one we are working with, we're in the process right now of empowering young people to create public service announcements that speak the language that they speak. You know, the older I get, the less teenager that I am able to speak. And so we're creating spaces so that they can translate the public health message into ways and venues that their peers understand. In addition to that, we also have had concerns that kids are able to access these devices within proximity. So due to that concern, recently the County Council has announced and will be voting on legislation that bans the sale of these devices within half a mile of schools within the county. I know that it has passed the Health and Human Services Subcommittee, and I think it will be voted on by the whole council within the next couple of weeks.
Dr. Mitchell, we have a minute before we go to break. You'd mentioned regulation. How are these devices regulated? And you have 1 minute to respond.
Sure. Well, unfortunately, the simple answer is they're not. The FDA does not regulate these products at this point in time. There's been a long legal question about whether the FDA had authority, how that authority was going to be used. And while it has been discussing that question, these largely have been unregulated devices, both here and abroad. So the simple answer is where cigarettes, in fact, are substantially regulated, these products have not.
Has there been any discussion about getting involved the Alcohol, Tobacco, and Firearms Division, ATF?
So that's a federal discussion, and I'm not part of that discussion at the state level. I think there are discussions currently underway about, and I expect those discussions will continue, about what the most appropriate way of protecting young people from the hazards that these represent are. And the most profound of these now, obviously, is Tobacco 21, the new law that Dr. Gayles referenced, which as of October 1st does actually in Maryland prohibit any person under the age of 21, with the exception of active duty military personnel with an ID, from purchasing any electronic cigarette product as well as tobacco product.
How interesting. We're going to pause briefly for a public service announcement. More about the national vaping epidemic in a moment. We'll be right back.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay? Just go to the site.
We're back, and our topic this evening is the national vaping epidemic. Dr. Gayles, when we paused for the break, we were discussing the many aspects of this challenging healthcare issue. Briefly tell our viewers about the national epidemic in terms of how many states were involved, how many patients, et cetera.
Sure. I'm guessing you're referencing the acute pulmonary illnesses that were secondary to vaping and that we experienced. We have seen each of the 50 states impacted and influenced by that, with cases in each jurisdiction. We've had cases here within Montgomery County where we have done some research to try to find out and understand better what's happening. There's been some variability in terms of the level of severity of lung damage secondary to vaping. CDC recently released some information suggesting that it was tied to the presence of vitamin E oils within the substances that folks have vaped. Initially, there was concern that it was tied solely to those who were vaping cannabinoid-based products, but evidence shows and suggests from talking to those patients and getting histories is that some of the patients who experienced those side effects were not vaping cannabinoid products. So I think one of the big issues is that we simply don't know the full spectrum of the side effects. Whether we're talking about the acute respiratory illness, we're talking about long-term side effects such as cancer development, things like that, or any type of neurological impairment that may be secondary to vaping. But in the cases we've seen, if I recall correctly, there have been roughly nearly 50 deaths associated with it, and over 2,000 cases, again, across the entire nation.
Dr. Mitchell, how would somebody with vaping lung present?
Well, initially, our unit has been doing epidemiology across the state looking at these cases. So initially, they present a variety of ways. Some of them have what looks like a flu-like syndrome, which I can talk about a little bit. Many of them start with a chronic cough and shortness of breath, but they go on to develop severe shortness of breath, such that they, even with mild exertion, they're unable to catch their breath. Some of them actually start with GI complaints, gastrointestinal complaints. And we've had a few that have been discovered almost accidentally because they went into an emergency department for what sounded like a gastrointestinal illness, and when they had an X-ray, the X-ray showed that their lungs had what was recognized as a characteristic pattern of these bibasilar, that is to say, both bases of the lungs, kind of ground glass appearance on X-ray.
So a little haziness.
Little haziness,
Yeah.
But almost all of them, especially the ones who are hospitalized, go on to develop significant breathing problems. They have to have supplemental oxygen. In some cases, they've been intubated and in an intensive care unit for an extended period of time.
By intubated, going on a respirator,
That
a
is
breathing
correct.
machine. Okay. And what kind of gastrointestinal symptoms do they present with?
So again, they tend to be somewhat mild flu-like symptoms with some nausea, some vague general abdominal discomfort, but then the shortness of breath becomes the more prominent symptom after a while.
So you mentioned putting people on respirators. What other treatments did these patients receive for their lung disease?
So first, from a diagnostic point of view, because these can look like the flu or other lung infections, it's very important for people to make sure that they don't actually have another lung infection. It is possible that amongst the many patients who have been identified, some of them could have had pulmonary infections. So one of the important things that the CDC recommends is that everybody rule out or eliminate the possibility that there's a lung infection causing this. So they tend to look sometimes very much like people with pneumonia.
Right.
And it's important to do that. Now, the important thing about that, obviously, is we want to treat people appropriately. So once the physician is confident that it is not a pneumonia from an infectious cause, in most cases, these patients are treated with steroids to reduce the inflammatory response and improve breathing. Some people tend to respond very well to the steroids. Other people can take a long time to respond, and some have such severe lung damage that even with steroid treatment, they may go on to have problems requiring hospitalization.
The patients who don't respond, who died, the 50 patients, has there been an analysis of what they died from?
So we do not have all of those details yet. That's still underway, as those patients may have had autopsies, and the CDC is collecting all of those data and will be releasing a lot more data as time goes on.
My understanding is that a few patients had such permanently damaged lungs that they went on to lung transplantation.
So in many cases, the lung damage is quite severe. Many of these patients have had bronchoscopy, so somebody has gone in and actually inserted a bronchoscope to look at the inside of the lungs. Some of the original case reports about these very early on suggested that there was a kind of an oily-like response, but there have been a variety of different kinds of findings on bronchoscopy, and as Dr. Gayles said, there has been this suggestion and a finding that in many of the patients, the fluid in the lung had vitamin E acetate in it, and you could show that that was similar to what was in the devices that were used. However, as he also indicated, north of 10%, sometime around 13% or so of patients have reported not using any products that we thought might contain THC, which is where the vitamin E acetate comes in. So by no means do we know the full story about this yet. We don't know which devices are the most important. We don't know which product's the most important. And we certainly can't say at this point that there's any product out there that is absolutely safe.
Sure. Dr. Gayles, the vaping devices that are out there, for example, the Juul products, do they contain vitamin E acetate? Or is it only the ones that involve cannabis?
Well, typically the vitamin E oils are additives to the cannabinoid-based liquids that folks jewel. And so let me take a step back. Part of the other challenge that has made it difficult to get a good epidemiologic understanding of what's happening is that you're talking about folks who are using devices, some who have purchased them from vendors, some who have received them from transactions in the street or secondhand. And that also speaks to where people are getting the liquids and things, substances that they're vaping. Some are getting them from legitimate vendors versus other secondhand sources. So that complicates and makes it more difficult to get a true understanding of where things are coming from. So to answer your question, from a manufactured Juul vaping product device, the answer is no, that's not something that's there. But then, who knows what happens if I've used the device and had something that did have vitamin E in it and you received that secondhand. It complicates that and makes it a little bit more difficult to know definitively. And to your point about the devices, one thing that I think is worth mentioning is that not all of these devices look like what we think of as an electronic cigarette. In particular, a lot of the Juul devices that young people use look like USB drives. And so it's easy to disguise. And, we've heard reports of kids who are using these devices in classrooms because the fumes are clear, odorless. It looks like a USB drive. Again, it's not something that's on your radar for teachers or parents to know what to look for. And so part of that outreach that I mentioned that we've been doing is trying to educate educational providers, teachers, counselors, all those types of folks to know what to look for and to be suspicious of, and then also to empower parents to know, if they say, well, I looked in my kids' stuff, I didn't see any cigarettes, that doesn't mean they're not juuling or vaping because there are other devices that are there.
Yeah, one of the products that I saw recently was a hoodie sweatshirt. And the vaping device was actually at the end of the lace and built into it. It's
terrible.
It's really, you would never have known.
Yeah. What is the position of the Montgomery County Public Schools in terms of these vaping devices that look like USB devices? Is it illegal in the school system? Can they confiscate it? What exactly are the options for a teacher if they suddenly discover somebody is vaping behind their back?
Sure. Well, I want to make sure that I don't misspeak and not speaking on behalf of MCPS, but in the work that we have done with them and working closely with them, we've learned that yes, you can confiscate those devices, which again is why we've worked hard to make sure that the teachers and other staff are aware of what kids are using. and to be on the lookout for in their classroom settings and in the hallways. We know that kids frequently congregate in spaces such as bathrooms. Some of the students report their vape rooms, no longer bathrooms, because you can walk in and be exposed to the smoke. So yes, they are confiscated, and I won't speak too closely on the disciplinary actions of the school system, but I do know that if you are caught with them, there are different levels of discipline that are taken. And one of the things that we're looking to do more as we move forward, especially as legislation is rolled out on a county level to make it more difficult for kids to get it, is we want to also make sure that when we identify kids who are vaping, and we may stop them from that, one, that we also are making sure that they have access to resources to address the underlying issue of substance use. So yes, I found that you're vaping. Let's make sure that you are linked to someone who can talk to you about that and discuss the root causes of why you're using substances. Are you using other substances such as alcohol and other illicit drugs? And then if we stop you from doing it, as we talked about, there is concern that there may be increased withdrawal symptoms, particularly for young people, and making sure that they're addicted. And so making sure that they are linked to the necessary services that they need to deal with those symptoms as well.
Dr. Mitchell, it was mentioned earlier legislation at a county level. As you know, there was a lot of interest nationally about having a federal law. And initially, President Trump advocated it, and then apparently caved to the interest of the vaping industry. Famously, they said, we vape and we vote. What is the status of a federal bill to severely restrict vaping in our country?
Well, at this point, I don't know of any legislation that would effectively do that. I mean, I think that one of the things to be aware of is we want to be careful not to drive the industry or behavior towards underground purchases. And I think that we all sort of are looking very hard at how do we think about this, because one of the things we do think is that it's likely that people who purchase products, as Dr. Gayles alluded to, on the street or from friends, and if you looked at, for example, the New York Times coverage of illegal manufacture of those underground manufacture of those cartridges, it's relatively easy for somebody in a home shop to buy a whole bunch of cartridges, fill them with a bunch of liquids, and then cut them with a whole bunch of other things. And we don't want to drive people in the direction of an underground market for these products. So I think, I don't know that a ban necessarily, that there's any legislation to do that at a federal level. And I think that for many of us, we want to think thoughtfully about how to make sure that teenagers and young people don't have access to these, but we also don't want to drive the entire industry towards the place where the most damage might be, which is a whole underground economy of products that are not only unregulated but untraceable.
Gentlemen, thank you for joining us on Housecall.
Thank you.
My thanks to Dr. Mitchell and Dr. Gayles for a very informative interview. My thanks to my team here at the station, and most important, my thanks to you at home for welcoming us for another episode of Housecall. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be very interesting. I'll have several primary care physicians discussing the challenges of serving as an internist or a family physician in Montgomery County. It's going to be a fascinating show. See you then next time for another edition of Housecall. Good evening.